Welcome to all of our spine surgery patients and family or friends who may be watching with them. My name is Dr. Ritu Zacharias, and I'm the Medical Director for Spine Services for Henry Ford Health System. We know that you may be nervous to have back or neck surgery. We have found that patients who are prepared for their surgery and their recovery will be less nervous and have the best results. Our unique spine prehab program will help you every step of the way. There will be 3 sections to this video. I will lead the first section, which will focus on getting you ready for your surgery, your hospital stay, and your recovery. The second section will be led by one of our therapists who will review therapy exercises and the best ways to do daily activities. The third and final section will be led by one of our brace specialists. Some of you will need to wear a brace after surgery, and so we will review the use and expectations of these braces. At the end of this video, you will need to complete the online quiz so we know you understand the basics for a successful spine surgery and recovery. More information is available in the Spine Surgery Handbook. If you did not get a handbook, an electronic copy is available on this website. Spine surgery is a partnership between you and your surgeon. You are in excellent hands at Henry Ford. Your spine surgery, recovery, and discharge from the hospital are specific to your needs. There are important steps to help you get ready for surgery. To begin, we encourage you to choose a coach. This is usually a close friend or family member that will learn about your recovery process with you. Whoever you choose should be available for at least a few days after you go home to support your recovery. Not every patient chooses to have a coach, but it's encouraged and has been helpful for many patients. Before surgery, arrange for someone to care for your home, yard, and your pet for a few weeks. You will also need someone to drive you home from the hospital and to follow-up appointments. Get your home ready for surgery, which is described in our Spine Surgery Handbook. Some examples include: do big loads of laundry before surgery. Stock up on groceries so you don't have to shop after surgery. Prepare simple meals ahead of time that can be reheated in the microwave or the oven. Put things where you can get to them without reaching, bending, or twisting. Remove loose floor rugs, clutter, and any cords that could cause you to fall. Practice the exercises that our therapist will demonstrate to you shortly and are described in the handbook. These exercises will help you prepare for your body for surgery and your recovery. If you smoke, it's very important that you quit as soon as possible. This should be at least 4 to 8 weeks before your surgery. This includes cigarettes, vapes, pipe smoking, e-cigarettes, cigars, hookah, chewing tobacco, nicotine patches, and nicotine gum. Smoking can increase your risk for infection. It can also increase your chance of developing pneumonia, a heart attack, and difficulty breathing after your surgery. You will need to continue not to smoke after your surgery. For those of you having a fusion surgery, any products that have nicotine may prevent your bones from fusing. If you need help with quitting, please contact your primary care doctor, call 1-800-QUIT-NOW, or visit the link listed in our handbook. If you currently take an opioid, also known as a narcotic pain medicine, you will need to slowly reduce your use of it as much as possible before surgery. We know that many of our patients rely on opioid pain medicine. Reducing your use before surgery will make it easier and safer to control your pain after surgery. Talk with your doctor that prescribes your opioid pain medicine about ways you can reduce your use now. There are several medicines that you will need to stop taking before surgery. Some common over-the-counter medications that need to be stopped are medicines that can thin your blood, such as aspirin, Motrin, Aleve, Advil, ibuprofen, Celebrex, naproxen, herbal supplements, and vitamins. Closer to your surgery, you will get a phone call from our pre-surgical department to review your medicine list in detail. There's also a list of common medicines that need to be stopped in the Spine Surgery Handbook. For those of you having fusion surgery, there are certain medicines that you will need to avoid for up to 3 months after the surgery. These include medicines that may prevent your bones from fusing. A full list of these medicines will be available on your hospital discharge instructions and in the handbook. Alcohol and marijuana can also affect your surgery and should be stopped at least 48 hours before your surgery. Other things you need to know before the surgery. You will need to complete any tests or clearances your doctor orders. As mentioned earlier, you'll get a phone call from our pre-surgical team to review your medical history and medications. They will also let you know which of your medicines you should take the morning of surgery with a small sip of water. For those of you who have diabetes, they will also let you know if you will need to adjust your diabetes medicines for the night before or morning of your surgery. Someone will contact you to give you your arrival time closer to your surgical date. There are flyers on our website that have additional details about each hospital location. They include important contact information, maps, and more, so please be sure to review these. Pack a small bag for your hospital stay. We recommend that you bring your insurance card, photo ID, and a list of medications that you're taking, reading materials, your phone and a charger, clean loose clothing for your hospital stay, and clean clothes to go home in. You'll find a complete list of other items you may want to bring in our spine surgery handbook. Please know that the hospital is not responsible for any lost valuables. Before surgery, remove all nail polish, artificial nails, tips, wraps, and gels. Fingernails should be kept short. This will help your team to accurately monitor your oxygen levels during your surgery and reduce the risk for infection. Remove all jewelry, piercings, and any hair clips, bands, wigs, hair pieces, or hair extensions with metal beads or clips. You will get instructions at your surgeon's office or during your pre-surgical call on when to stop eating and drinking before surgery. Some of you may have received this kit, which can help prevent an infection. Please be sure to follow all of the instructions inside this kit. It's important that you shower the night before surgery. Wash your hair and body with a regular shampoo and a liquid soap. Do not use a bar soap because of increased bacteria. Rinse off shampoo and soap completely. Wash your entire body except the genitals from neck down to your toes with chlorhexidine soap from the kit. Wash gently for 3 to 5 minutes. Turn off the water while you use the chlorhexidine or dial soap to stop water from rinsing the soap off too soon. Rinse your body well with the water. Do not use your regular soap after you use and rinse off the chlorhexidine or dial soap. Pat yourself dry with a clean towel. Do not use lotions, creams, deodorants, powders, hairspray, perfume, or aftershave after you shower. Brush your teeth and use the mouthwash from the kit the night before your surgery. If you did not receive the kit, you can use any store-bought mouthwash. Dress in clean clothes. Sleep on freshly washed sheets and pillowcases. Another tool in your kit is this breathing device called an incentive spirometer. Using the incentive spirometer will help strengthen your lungs and reduce your risk for pneumonia. Use it several times each day for up to 2 weeks before your surgery. If you did not get a kit, please perform deep breathing exercises by breathing in slowly through your mouth as if you're sipping through a straw. Hold your breath as long as possible. Slowly exhale. Rest for a few seconds and repeat. After surgery, everyone will receive an incentive spirometer and will need to use it 10 times every hour if you are awake for up to 2 weeks. To use the incentive spirometer, sit up in a chair on the edge of your bed or up as far as possible in bed. First, blow out all your air. Hold the incentive spirometer upright. Place the mouthpiece in your mouth and seal your lips tightly around it. Breathe in slowly and as deeply as possible. You will inhale like you're sipping through a straw. As you inhale, you will notice the large blue disc rise. Give it your best effort. The small blue disc should stay in between the arrows while inhaling. Hold your breath as long as possible. Remove your mouth from the mouthpiece and exhale. Allow the large blue disc to fall to the bottom of the column before repeating. Move the blue indicator to mark your best effort. Try to get the large blue disc to this level or higher during each repetition. Rest for a few seconds in between each attempt. After each set of 10 breaths, cough to be sure your lungs are clear. On the morning of your surgery, take another shower following the instructions as previously discussed. Brush your teeth and use the mouthwash again. Take any morning medications that you were told to take with a small sip of water. You will be asked to drink a high carbohydrate drink before your surgery. Be sure to follow the instructions provided at your surgeon's office or in your pre-surgical call. Doing this can help your body recovery by maintaining normal blood sugar levels, decreasing nausea and vomiting, decreasing muscle loss, and decreasing constipation. There is a surgical waiting room at the hospital for your coach during your surgery. There's also a status board to keep them updated on your surgery. It will take your healthcare team about 2 hours to prep or get ready for your surgery. The length of surgery should have been discussed with you by your surgeon during your surgical visit. After surgery, you will be in the recovery room for about 2 to 3 hours. Just before your surgery, your surgical team may use a nasal sanitizer swab, special wipes, and another mouthwash to help reduce your risk of infection. You may also have a quick scan of your bladder after you have urinated. Some other things you can expect while in the hospital are an IV for anesthesia, fluids, pain medications, and antibiotics, stockings and leg compression devices to help circulate blood and prevent a blood clot from forming. You may also get a blood thinning medication to help prevent blood clots from forming. A dressing will cover your incision. You will get care instructions before you leave the hospital if you need to go home with a dressing. You will get oxygen through a mask on your face that will typically be taken off while you're in the recovery room. For some patients, you may have a surgical drain placed during surgery. This depends on the type of surgery that you're having. This drain collects fluid and blood away from your surgical incision. Once the amount of drainage has decreased, the drain will be taken out before you go home. Some patients will have a urinary catheter placed during surgery while under anesthesia. This flexible tube is put into the bladder to drain urine. The catheter will be removed as soon as possible after the surgery. This is used because some medications we use during surgery can relax your bladder. Once the medications wear off, the normal urge to empty your bladder will return. After your catheter is removed, your nursing staff will monitor how well you empty your bladder. After surgery, you may feel nauseous or have a sore throat. Be sure to tell your nurse, who can give you medications or lozenges to help. We may start you with a liquid diet, and if you feel okay, you can then eat regular food. And now I'd like to take a moment to talk about pain after surgery. Surgical pain is normal and expected after surgery, but we will work with you to help control your pain and keep it at a level you can tolerate. Your pain may be strongest for the first 2 to 14 days after surgery and should get better as you recover. Your surgeon is relieving pressure off your nerves. It can take time for the nerves to wake up. And for some of you, these nerves have been pinched for a while. Think of a heavy equipment pressing on a garden hose for a long period of time. When you remove the heavy equipment off the hose, it may still be kinked, and it takes a while for the kink to work its way out. Same applies to your nerve. It may take a while for your nerve to heal and wake back up. As you heal, you may feel some new pain or a new sensation that you didn't have before your surgery, which is normal. This is a gradual recovery period. There are many ways that you can help reduce your pain, such as short, frequent walks, changing your positions often. The more you move, the less stiff you will be. Using ice packs is helpful, relaxation techniques, and also deep breathing exercises. There are many activities to help distract you, such as watching TV, reading books, and listening to music. There are a variety of pain medications that will be given to you after your surgery. These may include oral pain medications such as Tylenol, a muscle relaxor, and/or an opioid. You may also get pain medications through your IV. Your nurse will help you with all of this. Do not wait until your pain is bad before you ask for pain medication. Otherwise, it will be much harder to manage your pain. We do expect you to walk within several hours or sooner after surgery, as long as your surgeon says it's okay. Walking within several hours or sooner after surgery is one of the most important things you can do to speed up your recovery and prevent complications. The benefits of early walking include better pain control, improved blood flow, improved lung function, and quicker healing. Early walking after surgery also helps prevent many surgical complications such as infections, pneumonia, blood clots, muscle spasms, urinary tract infections, constipation, and urinary retention. This is when your bladder retains or holds a lot of urine. Be sure to ask for help to get out of bed. Sit on a chair for all of your meals. Avoid sitting and lying down for longer than 1 hour at a time without changing positions. This will prevent stiffness and it will decrease your pain after surgery. Gradually increasing your walking distance is very helpful. Do this every day as much as you can. If you haven't been physically active in a while, you may have to start slow. Start with just 10 minutes of walking each day. Then add 10 minutes each week until you are moving an hour each day. For about 6 to 12 weeks after your surgery, you will have restrictions, and to help you remember these, just keep in mind no BLT with 2 pickles on the side. The B is no bending your surgery site, forwards or backwards. The L is no lifting anything greater than 5 to 10 pounds, so nothing greater than a gallon of milk. The T is no twisting your surgery site from side to side. And the 2 pickles are no pushing or pulling anything greater than 5 to 10 pounds. You'll also want to avoid reaching overhead with your arms, as this can strain your spine. So keep things where you can get to them. Getting ready to go home. Before surgery, your surgeon should give you an idea about how long you will be in the hospital. Please use this information to arrange for a ride home and help once you get home. You will not be allowed to drive yourself home. Your team will give you detailed discharge instructions when you are ready to go home. Please be sure to follow these instructions for the best possible outcomes. It is most common for our patients to go home after their hospital stay. Going home instead of a rehab or nursing facility has many benefits, and you can still go home even if you live alone. Sometimes, however, patients may not be able to go home. Your care team will decide this with you during your hospital stay, and our discharge planners will help you make arrangements as needed. Once you leave our hospital, you will be required to follow up with your surgeon's office. During these visits, your surgeon will let you know when you are cleared to return to your normal activities, drive, and return to work. For those of you that must wear a brace, they will also let you know when you can stop wearing it. These will also be in your discharge instructions. Incision care and infection prevention are very important for your recovery. Washing your hands often is the best way to prevent infection. Also, have family and friends wash their hands when they're visiting or helping you with personal care. Once your surgeon says it is okay to shower, then you can. Take a quick shower daily. You may be asked to cover your incision while showering, depending on your surgeon's preference. Use a clean washcloth and a clean towel for every shower. Do not use the washcloth directly on your incision, and do not share with family members. Use a mild liquid soap such as Dial. Do not use bar soap, as this may cause more bacteria. Gently clean around your incision first, then the rest of your body. Rinse well without directly spraying the incision, making sure no soap residue remains. When drying, pat your incision dry first with a clean towel, then dry the rest of your body, being careful not to touch your incision. If you need to apply a new dressing after your shower, be sure to only touch the corners of the dressing, not the area that will touch the incision. Put on clean underclothes and clothes daily after each shower. Do not apply lotions, powders, creams, ointments, rubbing alcohol, hydrogen peroxide, or iodine to the incision until it completely heals, which may take up to 6 weeks. Do not soak your incision under water until your incision completely heals. This means avoid baths, swimming pools, jacuzzis, and hot tubs. Make sure you have clean sheets on your bed when you get home. Place a clean sheet on any chair, couch, or recliner you use. Change sheets at least weekly or sooner if dirty. Brush your teeth or dentures daily. Pets should be kept away from your incision. Do not let your pet on your bed, chair, or lap while your incision is healing. You will be sent home with pain medicines, one of which may be an opioid or a narcotic. The state of Michigan now limits us to prescribe no more than 7 days of opioid medicine at a time for acute surgery pain. Please keep track of the pain medications you take so that you do not take more than what is prescribed. Opioid medications can help with short-term surgery pain, but can be very addictive and have serious side effects. Start to slowly wean off these medications by gradually increasing the time between doses. If you need a refill, contact your surgeon's or prescribing doctor's office at least 48 hours before you run out of pain medication. We will need to complete a pain assessment and discuss weaning goals before any refill. After surgery, you will be at a higher risk of developing constipation due to decreased activity, anesthesia, and opioid pain medicine. A few things you can do to help reduce constipation are: take frequent walks, drink plenty of water, increase your fiber intake. This includes vegetables, fruits, whole grains, and beans, and chew gum right after the surgery. During your hospital stay, you will be given stool softeners. You should continue to take over-the-counter stool softeners every day once you get home for as long as you take opioid pain medicine. Once you are home, please contact your surgeon's office if you experience any of these symptoms: redness, swelling, drainage, foul odor, or opening of your incision. Check your incision daily. If you develop consistent fevers greater than 101 degrees, new weakness in your legs or arms, severe uncontrollable pain, pain or redness on your calves, or difficulties with bowel or bladder function. Always call 911 if you experience chest pain, shortness of breath, or difficulty breathing. And now I'd like to introduce one of our therapists on our spine team.
Hi, my name is Allison Rhoda. I'm one of the occupational therapists with the Henry Ford Health System. The goals of occupational and/or physical therapy during your hospital stay is to ensure that you are using proper body mechanics and that you're able to complete your activities of daily living. What you can expect after your surgery is either an occupational or physical therapist will evaluate your strength, your balance, your coordination, so that we can come up with the appropriate treatment plan for you. One of the responsibilities of the occupational therapist to you is that we will show you adaptive techniques or adaptive equipment for you to be able to maintain your independence after your surgery. I'd like to discuss some ideas for home safety prior to your surgery. If you can have meals prepared so that they're easily reheatable, that is helpful. Other than that, you want to make sure that frequently used items are within accessible arm's reach. Keep things on counters if you're able to. One of the first things we're going to do as therapists entering your room is to make sure that you know your BLTs with the pickles on the side. Again, as Dr. Zacharias had mentioned, B stands for no bending forward or backward of your surgery site. The L stands for no lifting greater than 5 to 10 pounds. A full gallon of milk is 8.6. Allow that to be your guide. The T is no twisting right or left of your surgery site. The pickles on the side are no push, no pull, greater than 5 to 10 pounds. Please remember, limit the overhead reaching as that tends to be very straining on the spine. After we make sure that you know your BLTs with the pickles on the side, it is vitally important after your surgery that you frequently position yourself and take short, frequent walks every 45 to 60 minutes without fail. If you lose sight of time, it's helpful to set a cell phone timer or an egg timer to remind you to do that. Feel free to get up more frequently as needed. Just don't push it past an hour. If after your surgery you feel slightly unsteady when you're on your feet, your therapist may deem that a rolling walker may be appropriate for you. But remember this, if you weren't using a walker or any adaptive equipment prior to your surgery, chances are that you won't need one when you go home. Our therapist will evaluate you for that. For those of you having neck surgery, it's important that you do some exercises prior to your surgery, since after your surgery, many of you will be in collars and those muscles will be weak. Start with putting your forehead in your fingers to a count of 5. Bring your hand over to your temple, push in slightly, count of 5. Back on the back of your head, pushing slightly into your fingers, another count of 5. and then over to the other temple for another count of 5. You're going to want to do these 2 to 3 times a day prior to your surgery. For those of you having low back surgery, you are also going to want to do some exercises, as these muscles tend to get weak after your surgery. To do your back exercises, you're going to want to log roll into bed, turn over onto your back. The first exercise that you're going to want to do, squeeze down on these abdominal muscles for a count of 10. The next exercise, you're going to want to lift up in your hips, round down into the bed, also counts of 10. Third exercise, squeeze your buttocks like you have a $100 bill and you're not willing to give it up. For those of you experiencing pain prior to your surgery doing these, please stop. It is important to practice log rolling after your neck or low back surgery. Log rolling is called log rolling because you're essentially rolling like a log. When you sit at the edge of the bed, you're going to come down onto your forearm, keeping this upper arm in front as not to twist your spine. You're going to stay on your side until your feet are physically up on the bed. Then you can go ahead and roll back and get yourself in a more comfortable position. For those of you having neck or low back surgery, the only unacceptable position to be sleeping in is on your stomach. For those of you that are side sleepers, you're going to log roll onto your side. Vitally important to have a pillow between your knees so that it keeps your spine nice and straight. For those of you having neck surgery, it's helpful but not essential for you to keep a pillow under that upper arm for comfort reasons. Prior to sitting down, you're going to want to ensure that you are in fact as close to the chair as what you think you are. Feel the chair behind both of your legs prior to sitting down. As not to bend or twist by reaching back for the chair this way, you're going to want to squat in your hips and knees and reach back for the chair this way. A chair with arms is always easier than one without. Regardless, anytime you're prepared to stand up, you're always going to want to scoot forward, get your feet underneath you and shoulder width apart, and push up from whatever surface you're getting up from, not a walker or a cane if you have one in front of you. Prior to getting into the car, your driver is going to want to adjust the seat in the backmost position to allow yourself extra leg room. Also, it's helpful to recline the seat back a little. It'll give you a little bit of leverage to get over the door jamb. As with any surface, you're going to back up until you feel the door jamb behind both of your legs. Let go of anything that potentially could move, canes, walkers, doors. You're going to want to position your hands on solid objects, the dash, the beam, or the seat back, and squat down into the car. Once you're here, you're not going to want to twist your spine as you're carefully lifting your legs over into the car. For most of my patients after these surgeries, they find it more comfortable to be sitting upright as opposed to reclined. If you prefer the reclined position, that is acceptable. However, prior to your driver taking off, go ahead and adjust the seat back to where you think it's going to be comfortable for the duration of your trip. When you're getting back out of the car, for those of you that have lifted the seat backs in the upright position, slightly recline them back, lift your legs over the door jamb, being careful not to twist, and with any surface, scoot as far forward as you can, getting your feet behind you and spread them apart so that when you stand up, you can leverage on the dash, on the beam, or the seat to be able to stand up from the car. It's important that you know the techniques for bathing and dressing. For those of you that have the flexibility of bringing your foot up over the opposite knee, this is your path of least resistance, as you are not allowed to bend forward. For those of you having neck surgery, it becomes very straining on those muscles to flex down towards your feet. For those of you that are unable to do this, your therapist would show you some long-handled adaptive equipment to maintain your independence in lieu of you not being able to reach your feet. Toileting becomes a trickier little endeavor. When you're sitting down, if you can isolate your shoulder and reach back to your posterior side, that is your path of least resistance. For those of you that feel like you are bending and twisting to be able to access that area, stop that technique as it can be adverse for your surgery and go to Plan B. This is no reflection of how I feel about any of you, but this is Plan B. When you stand up from the toilet, spread your feet apart to give yourself a wide base of support. You're going to bend your hips and knees so that brings your hand down to your posterior side without bending and twisting your spine. For those of you having neck surgery, it's important to maintain the cleanliness of your brace. Prior to eating, drinking, and especially brushing your teeth, you're going to want to use a dry washcloth or a cloth napkin to put a barrier between your chin and your brace. When you brush your teeth, it's helpful just to be able to spit into a cup, as when you lean forward into the sink, it's easy to spit down into the brace. The technique when you're getting shirts on, whether they're long sleeve or short sleeve, is put your arms in first. More so than that, sliding those sleeves all the way up to the shoulders as humanly possible prior to bringing the hole over your head. If you don't get those sleeves all the way up to your shoulders, let me show you what happens. It tends to pull the head and the neck forward, so it's important to get them all the way up. For those of you that have stairs in your home, it's important that you limit the amount of flights of stairs that you do during your day. You want to ensure that you're able to do your short, frequent walks and frequent positional changes from the moment you wake up to the moment you go to bed. So limit those stairs once in the morning and ideally once again at night. For those of you that have a bedroom on a different level of your home, ensure that you have everything that you need for the duration of the day to come down with you. You do want to limit stairs to 1 to 2 times a day. If you're watching this video, we know that you've had quality of life issues and all conservative treatments have failed you at this point in time. We are so eager to get you back on track and back to quality of living.
Hi, I'm Stella Myers, one of the brace fitters for Henry Ford Hospital. If you're having a lumbar fusion and your surgeon had prescribed a brace, you'll be receiving this brace or one brace similar to this. When this brace is on, this panel will sit in the center of your back and the bottom of the brace will sit at the top of your buttocks or where your pants pocket starts. The panel velcros in the front. There are a set of pulleys on either side of your brace. You'll pull those until they're snug, but not tight, and that sits right into the front of your brace. You're gonna have this brace on anytime you're up, sitting, standing, and walking. You can take this brace off when you have a bowel movement, in the shower, and when you're sleeping. Some of you will receive your brace day of surgery, some evening of, some 1 to 2 days after surgery. Regardless of when you receive your brace, you are expected to get up and walk. Once you receive your brace, the same rules apply to you. You'll have that brace on anytime you're up, sitting, standing, and walking. When you wear this brace, you'll have it over your clothes. Don't wear it directly against your skin. You're going to be in this brace for 6 to 12 weeks. Your surgeon will let you know when you can discontinue the brace. When you're done with the brace for the day, you're going to reset the pulley systems. And you're going to do that by releasing the pulleys and putting them on the side. It not only releases the pulley system, it protects the Velcro from dog hair, cat hair, and lint. If you're having a cervical fusion and your surgeon has prescribed a brace, you'll be receiving this brace. When this brace is on, your chin sits on the lip and your back overlaps the front. It Velcros onto the side. If you're able to put your fingers between the chin and the brace rest, you'll have to turn the dial to raise the chin rest so that it supports your head. Not only does this brace support your head, it also serves as a reminder not to turn your head to the right and left, that all your movements are at the waist. You'll have this brace on for 6 to 12 weeks. Your surgeon will let you know when you can discontinue the brace. You'll have this brace on at all times. The only time you'll take this brace off is to take a shower. Some of you will be required to shower in a collar, some of you will not. If you are required to shower in a collar, one will be provided for you. The pads on your collar are removable. They're hand wash, warm soapy water, air dry.
Thanks for watching our class. Please be sure to check out our other resources listed on this website. You will be able to find our spine surgery handbook, which explains everything in writing. You will also be able to find links that contain specific information about the hospital you're having your surgery at, including maps and important phone numbers. There's also a blank medication list that you should fill out and bring with you on the day of your surgery. Now that you have finished watching this video, please be sure to take our online quiz. This will be required so that we know you watched this video. A member of your surgical team will receive your answers. This will help us to ensure you understand the basics for a successful spine surgery and recovery. Thanks again for joining us today. We hope you found this very helpful. By following everything we explained in this class, we expect you to have the best possible outcome. We wish you all a speedy recovery.